Hello, and welcome to another edition of BNEWS In Depth. I'm your host, Rich Hosford. This month we are looking into an important issue: substance abuse, addiction, and the pandemic. We'll take this in two parts. First, I'll talk to Captain Greg Skehan of the Burlington Police Department about their substance abuse assistance program and how it has been impacted by COVID-19. Second, we will talk to that program's coordinator, Margie about how the pandemic has impacted people suffering from addiction, the resources available to them, and what has been changed to ensure that they can seek treatment. We have a lot to talk about, so let's get started. Now, welcome to Captain Greg Skehan of the Burlington Police Department. Captain, thanks for coming in and taking some time today.
Thanks for having me. Good afternoon.
Well, it's an important subject, and we're here to talk about it. I will note we are socially distanced in our green room studio here at BCAT. Just want to go back a little bit and just sort of talk about how, PARI and the Burlington Police Department first sort of got together.
Yeah, originally came through a grant, and that's how we adopted that program. The funding was through that, and we ran it for 2 years. Initially with the Burlington's own PARI unit, with a recovery coach and a supervisor of the program. And then the second year, we went to a regional model and joined with Wilmington Police and Wilmington and Woburn Police Departments along with Burlington. So we had 3 towns together combining those resources under that one PARI program. That was the second year. Now we're in our third year, and at this point here, the town of Burlington has clearly seen the value of the program and the need for it, and they've been good enough, folks in Burlington, to adopt this program as part of our budgetary funded programs, and that's where we're at now with PARI.
Yeah, that was a decision by town meeting, correct?
It was, yes. They've been very supportive, and quite right away, they saw the good that we were able to do through this program and the need for this program, given the opioid crisis and folks in town needing support for any type of substance use disorders, alcohol, drugs.
Yeah, what do you see as the main value of this particular program as opposed to sending people somewhere else, to have it in-house at the police department?
Well, with in-house you have not only better control over being able to help people, making sure that help is there because we have control on our program, but the great thing is this program, the PARI and I call it PARI although we've adopted it, but what once started as PARI, this program here works well with other programs that we have. So collectively, those give us a holistic approach to helping folks. So our efforts in PARI combined with that of our mental health program and our domestic violence unit. We have an officer who's assigned to seniors, so we're working with Council on Aging. So when you really bring all those programs together, we can tackle any issues that come along, and issues being a variety of folks in town or guests to our town who need assistance, and we have those programs in place for follow-up and sometimes working alongside officers as the need arises.
And what are some of the major needs that you see here in Burlington?
Well, particularly now with the coronavirus pandemic, we see that there's added stresses to everyday life. So unfortunately, with folks not being able to get to their doctors and have some of the support that they once had in the past, there's those added stresses. And we do see that. We've seen an uptick in folks needing that assistance through follow-up. And also, possibly, we believe, maybe self-medicating to get through the pandemic. And that's always the issue. So we're very busy. We've adjusted the way we approach this because we have to be safe during the COVID-19 pandemic, but we're essentially doing the same things, but changing the way we operate to make sure that we're protecting ourselves and other people and being socially distanced safe, wearing the PPE that we need to wear.
Yeah, and we're definitely going to get much more into the pandemic in a bit, but just sort of kind of laying the foundation of Perry. Is it mostly opioids? Is it alcohol? Other types of what sort of do we have? Mostly here in town.
Well, the opioid pandemic was certainly something that brought this to where it is because of that immense need nationwide. And there probably isn't a community in the United States that hasn't been touched in one way, shape, or form because of the opioid crisis. But the Perry approach, and that's the approach we're still using, is really geared towards any type of substance use disorders, whether that be any types of drugs or any type of alcohol. Again, it's really that type of program because, again, people deal with things in different ways, and people are coping with various what we call substance use disorders. We used to talk about addiction. Clearly, as you see, we use these terms where we now appreciate the fact that folks can be victims of substance use disorders, and we appreciate that, and that's why we're here to help them get through that as they cope. And not just them, these folks who are dealing with this, the families as well. It can be very, very challenging when a loved one within your family is coping with these substance use disorders, and it impacts the family, the extended family. It's very important, a very important thing to be focusing our energy towards.
Yeah, that is one of the things I wanted to ask about, is sort of a shift from, somebody having some, substance on them automatically being, viewed through a criminal lens rather than an illness lens. Talk about, that sort of shift in policing.
I think that is something that shifted nationwide, and Burlington, we've always made an effort to be in touch with our community, responsive to our community, but also stay on the cutting edge of things. And this has been coming for a while. It doesn't mean that police turn a blind eye to distribution of drugs. That we still enforce those laws. But people who have become addicted to drugs, clearly they need that help. And so we absolutely view them in a different way, in that we want to get them the help to overcome these addictions. And it's not just about enforcing the law and focusing on the fact that somebody had drugs and the criminal charges. We know that we have to do something to help these folks to overcome that. And they're part of our community, and we care about them. So we're really happy to be working on that aspect of this.
And has it been, difficult to convince people that, just because it's in the police department that, they can show up or they can call you, or, if it's a family member, they can contact you and they'll be, assured that they're going to get help and not, get in trouble?
I think it was more difficult some time ago. I think a lot of people are aware, and we've seen this change in mindset, not just here, everywhere. I maybe initially go back three years ago, there might have been some effort that we needed to make in regard to educating people about what it is, and that it's not soft on crime, and it's really providing a more holistic approach to problem solving. And this is a problem, and a very important problem, because it affects families and individuals. But I think we're really getting past that. I think now today, it's just how to best direct our resources with the vast amount of people who need help. And like I said, with coronavirus and the other challenges, 2020 has been a tough year. Those numbers have only gone up. So we again focus, how do we best meet the needs of the community and guests to our community? But educating people on the value of this, not as hard as it was. I think a lot of people, even on a national level, have really come around to seeing the value in helping people overcome the substance use disorders. And at the end, we're really helping everyone, helping individuals get back on track and where they need to be to get their lives back to where they want them to be, and help families get back to a sense of at least, I won't say normal, but at least out of crisis, you know what I
Right.
mean? And so I think it's been much easier in the late days here because people really do see the value. I don't get a lot of questions questioning the value of these programs anymore. So
Yeah,
that's
no,
good.
I don't think anyone would question the value. Just
Yeah.
make sure that they were.
Yes. Oh, yeah, well, yeah, exactly. So back to your original question, putting ourselves in the seat in the position of someone who is calling on behalf of a family member or calling or reaching out on behalf of themselves. Yeah, I think the trust is better now. There's always going to be, you always have to be mindful of that, and that's why we do promote these programs and have events so that we can break down any of those walls and barriers. Sometimes, in addition to folks being afraid of what might come, let's say criminal, I think there's also a sense of you have pride there, and people don't want to admit they need help, and it's not something that is something that you necessarily want to target. It's personal to them. So there's those barriers as well.
Yeah, the stigma.
The stigma, exactly. So you have a combination of a number of factors as to why someone might not call or delay calling. So we're still out there, and we're trying to promote this program to let them know we're here to help and to show them really through our actions that we truly are. It's not just lip service. It's something that we're doing and will continue to do.
Very good. And it seems like it's a big picture, not having people arrested, not having them get records. Back when that was the sort of the regular procedure, it seems like people would just, recidivate, just go back to,
Sure.
drug use even more. And this seems like it's trying to kind of, change that system.
Absolutely. There's nothing more rewarding than helping folks get to where they want to be. And it's very important. And we know that, we're bringing this holistic approach now. The old ways of just focusing on the crime of possession with no help for someone who might be suffering from the substance use disorder. We know that wasn't working as well as this works, if at all, in some situations, right? In that regard, we know we're taking what we've done before, but we're bringing in this new element, and it really is holistic. Again, these are people who have become victims of substance use disorders, and they're dealing and trying to cope with those. So what better thing to be focused on than actually helping people, members of our own community, to come out of that crisis situation and get into a place where they want to be.
Now, one of the things that you mentioned was, trying to educate people. I know you've had some, different events. There was a reading of a play about recovery,
Right.
A Narcan training. Just talk about the importance of just sort of getting the word out there, and maybe even also just having people talking about recovery, seeing police officers as part of, of that approach.
Well, you and I just talked about stigma. As we try to educate folks, one of the most important things is letting them know they're not alone. From talking to Margie, a lot of people, families, have said, I thought it was just us. I thought it was just me, someone who is coping, so I thought it was just me, or family members, I thought it was just my son, or my daughter, or my husband, or wife. So that goes a long way to know that other people are coping with the same things they are. And then from that, you have support groups that are available, and folks might be a bit more willing to participate in those. And so that's a big component of it. And then just knowing that the police are here as a partner, along with our units, our specialized units, what was once PARI, our substance use disorder unit, along with mental health. We have these programs for that purpose, to improve quality of life for all our citizens and guests to the town.
Excellent. All right, so program is in the third year. Things were going well, services were being provided, and then March happened. So things shut down. What was sort of like the initial impact of, COVID-19?
Most importantly, just the way we interact with folks. Whether they're coming in, we're making sure that we have the mask, the PPE, that we're socially distancing to protect people outside the department and inside the department. But What we do is still the same. Again, providing that support on the end, the follow-up end, or during incidents where someone's in crisis, maybe going to be going down to the hospital for a variety of reasons, and we get our counselors out there when the time is right, when folks are willing to say, "Gee, I'd like to talk to Margie Taylor about this." And so again, what we do is the same. How we do it, we've just added those factors that you and I have spoken about to protect them and us, given the pandemic that's going on, to minimize any exposure.
Now, of course, with everybody at home more, stressed, maybe losing their jobs or being furloughed, have you seen, and I think you made a quick mention of this, but what kind of impact on people have you seen vis-a-vis, relapse or, just an increase in use?
Yeah, we've certainly seen an increase in disturbances across the board. I think, some people are having a tough time dealing with normal stress, and add all these additional stresses. We've got that. And then people also possibly self-medicating. We can look at the data and we can extrapolate from that, make some guesses as to why that is, but it certainly appears that way. We haven't seen folks using substance use disorders going down. It's very much there, and it across the board's an uptick in most of them, and so that's why we're seeing alcohol use, substance use still high. So this program is even more important now than it was before.
Yeah. Have you had like an increase in incidents, people drunken behavior, or?
Yeah, Margie is the one dealing with it mostly, and she has said to you she sees it, and so we look at that and we certainly see a lot of people coping, a lot of threats of suicide and other things that we normally do see, but we're seeing more of it, and we again, you look at data, you don't want to ever jump to conclusions on data, but I think we see the uptick during the coronavirus pandemic, and 2020 has been a tough year. So it's not unreasonable for us to assume that maybe just these added stresses are making things even a little tougher for people this year. So that's what we see. But as time goes on, that the data that my team collects will be even more valuable, because we'll be looking at it not only as it happens, but we can also compare it as we get through 2020 and look back. Our positions on what has transpired will be even stronger, because we'll have more data to look at and use that going forward, again, to help us best direct our resources. But yeah,
so if we go into another fuller shutdown again, you'll be more prepared than the first time around?
I think so. I think we were always prepared, but it was new for us, and we were working as we go.
No one was prepared for what happened.
We were working as we go, but yeah, sure. I think we learned a lot from the springtime outbreak, and we're going to use that as we head into the fall. So we're prepared that there will be, and we're seeing numbers of people coming down with being positive for COVID, and we go from there. So I think we're well positioned to keep working away at this as we always do, and continue to provide that support to folks as they need it, and they certainly need it.
Yeah, absolutely. I wanted to ask specifically on the opioid front. Has there been more cases of like the need for use of Narcans and measures like that during the pandemic? Margie would best be able to speak to stats and data on that, but it's certainly there. What we're seeing now is there's a lot more folks distributing Narcan and administering Narcan more than police as well, because we have trained people in Narcan. So we have even seen civilians use Narcan. Fire department uses it, as do we. So that's the beauty of it. When we did trainings back, we're probably going back about a year ago. Yeah.
A short time after some Narcan training, some of the very people who were in that training and received Narcan with that training, then later, a short time later, administered Narcan to folks who were overdosing, and 2 that I can think of, one in town and then one in Boston, where civilians brought people back with Narcan. So the interesting thing is this: we've provided the training, Narcan now in the hands of civilians so they can use this life-saving drug. But some of that data, because we don't always get feedback and it can go to other towns and other places, we may lose that or not have that feedback, but we know that it's happening. So now you've got that element. It was police and fire administering Narcan. Now we have civilians administering Narcan when they see someone who is overdosing. So you follow me? So on that there, we can lose some of that, and we can only guess at the stats because that Narcan went out to other towns and we might never be notified of it. But we know of a couple, and at least a couple where people's lives were saved because of the Narcan, one in Boston, and then one here as well. And I would imagine that the Narcan was distributed more. And thankfully, we were on the cutting edge with this. We were one of the first departments to roll up here, one of the early departments. But I know it's become more and more standard for many departments. So there are many programs like ours in Burlington now in other towns who have started those up. So I think a lot of good is going on around the state and hopefully around the nation as well. Massachusetts is a little ahead of many of the states.
Yeah, well, that's good to hear.
Yeah.
Before we kind of like wrap up, I guess just, if someone's watching this and they're struggling, or they have a family member or friend or somebody in their life that's struggling, what would you tell them, as far as encouragement to take that first step?
Yeah, I would encourage them to visit our website or call. They can call the station and ask for Margie Taylor, and she is our substance use disorder recovery coach.
Yeah,
and
she's coming up next.
She's coming up next, and they could leave a message for her, talk to her directly. She's a wealth of information as far as resources, help after the fact, and what really a good recovery program might be for people. And you'll hear her say, it's all individual based. Everyone's different. That's one of the things we do. But there are a number of common themes that run through that as one now moves towards that recovery. So it's very important. And as you know, Margie and our other coaches are people who have recovered. So they're not people who don't know what it's like. They have recovered from substance use disorders. So they're in a very good position to relate and give advice to people about how they can best approach their road to recovery. And again, always individualized. You'll hear Margie say that no one program fits all. And that's very important too, because again, everyone's different, and what works for one person might not work for another. At the end, we care about the end goal, helping these people. And we know there's many different ways to make that happen, but nevertheless, still many common themes that run through that as you work towards recovery. So very important that they reach out to us, know that they can have a confidential conversation with her, and we're here to help to give them the support they need.
Very good. Well, I think that will just about do it. I really appreciate you taking the time to come in and talk about this important program today.
Excellent. Well, thanks so much, and I want to encourage anybody watching to visit our website and take a look at some of the programs we have, and those resources are here for that very purpose, to help folks and to just improve the quality of life for everyone in Burlington, and then people who come to our town as well. Anybody in our town in crisis, we're going to help them, whether it be related to mental health, substance use disorders. That's what we do. That's really what public service is all about. We're very committed to that.
Very good.
Okay, thank you.
Thank you again.
We go now to my interview with the Burlington Police Department's Substance Abuse Assistance Program Coordinator, Margie Taylor. Let's take a look.
All right, I'm now joined by Margie Taylor, who is the Director of Burlington's Police-Assisted Addiction and Recovery Initiative. Bit of a mouthful there. We'll just call it PARI from now on. How are you? Thanks for coming in.
I'm good. Thank you for having me.
So, obviously we want to talk about, the effect of the pandemic on treatment, but I wanted to go back a little bit. Just talk about, first of all, what is PARI? I know it's a sort of a grant organization, or based on grants. So just explain the, the sort of ins and outs of the organization.
So PARI started back in, I want to say 2014, 2015, and it started out of the Gloucester Police Department. They were seeing an uptick in overdoses and drug-related incidences, and so they started a program where you could go into the police department 24 hours a day, because they tried to think of what is 24-hour access for anybody struggling, and they would allow you to come in. They would not hold any drugs against you, and they would help you get treatment right there on the spot. So they took the burden of you having to call and figuring out where to start to find out where to go and get you into treatment same day. And out of that came PARI. And so let's build an organization that's built out of a police department with law enforcement as a partner and getting people treatment same day referral and helping them with that process.
And was it difficult to sort of build trust with people? I think, people who have drugs don't usually think the place I want to go right now is the police department.
Right, and so that, that can be a burden, and it still can be a barrier nowadays. It's not as bad. Some police departments have learned that running people's names for warrants, isn't very helpful, and that people don't ask for help. So police departments are seeing the positivity of helping people get treatment, and so we've tried to make it clear that we're not going to run people for warrants. We're not going to have them be held accountable for drugs that they have on. But what also is helpful is to have somebody like myself that's not law enforcement to help them get in the building and get help. So you kind of take away that whole having to go to the front window and kind of say, hi, I'm here, I need help. They could set up an appointment with me and come up to my office and kind of take that scariness and that, that feeling of fear that, am I going to get help or am I going to get arrested away?
Right.
Yeah.
And, you mentioned that you're not in law enforcement. What is your background and how did you get involved with the Burlington Police Department?
So my background is nursing. So I graduated with a Bachelor of Science in Nursing from Salem State. I worked as a nurse for many years in Lynn in the emergency room. And so with that, in a tough city, I saw drugs and alcohol being used a lot. There was a lot of violence and different types of game activity. So I had been exposed to that, but I also am in recovery and had an injury where I was, prescribed pain medication for a long time. I had 7 surgeries in 8 years, and I became physically and emotionally, mentally dependent on them. So I have the personal time invested where I wanted to help others. I have the medical background that kind of helps me navigate the healthcare system. And I knew the executive director of PARI, and I wanted to make a difference. And so I kind of got linked in with Burlington. They were in the community. I'm a Wilmington resident and grew up in the area. And so I really wanted to help my own community. And Burlington being right next door, I felt like, let me give back to home, to the people in my community. And I had an interview with them, and it seemed like a good match, and that's how I got started.
Now, you had mentioned Lynn, right, where you were before?
Yes.
And so just talk about some of the perceptions that people have of addiction. I think people think, well, Lynn, sure, there's going to be,
Yeah.
a lot, but not so much in a neighborhood or a community like Burlington or Wilmington. But that's not the case.
No, it's not the case. What goes with being in an affluent community like Burlington or Wilmington is that you tend to not be on that poverty level that you are in like a city like Lynn. And so you have the means more of having, money or jobs to actually afford the drug use. And so it kind of flies under the radar a little bit. And due to the stigma, you think of a city like Lynn, you think of all the negativity and that city-like behavior that you hear about, that you don't hear about in Wilmington and Burlington, and it's that people don't want to talk about it because of the stigma behind it. That makes it very hard for people to reach out for help. But these affluent communities that you think, oh, everything's perfect and I have the white picket fence, behind that picket fence is a lot going on, but people just, they don't associate it with that. But comes with the money is the means to buy things like prescription pills on the street that are a little bit more expensive.
Right. And how has treatment changed over the years, and what sort of, what has been sort of found to work better than maybe what was done in the past?
So I think in the past, a lot of people would go to detox. They would say, what's called a spin dry. You kind of go in for 5 to 7 days of detox, and you go right back out to what you were doing. There was no long-term care. There was no checking in. sober living, things like that. Now, obviously, we don't have the amount of treatment that we truly need, but they're building more and it's happening, not as fast as we need, but there's more options now and there's more an emphasis on extended care. So you go to D and you do a program, and then after that you graduate out to, say, sober living, a halfway house, doing outpatient treatment. There's more emphasis on the continuum of care. And the longer that you're in treatment, statistics show the higher success rate of being sober long term. And that going in for 5 days of detox and returning home to your regular life is not working.
Right. So it's not just a in and out sort of thing.
Correct. Yeah.
And is there a big difference between, say, the treatment for opioid addiction as opposed to alcohol or other drugs?
I would say that they're the same. I mean, you can go to any detox and they will detox you from alcohol or opiates. So there's not one detox that just does one substance. So you can go in for anything. It's very much readily available. I think now we're hearing more about the opioid epidemic because of the high rate of overdose and death. You don't hear that as much with alcohol, but there is still that struggle. And so people are struggling with all types of substances, but the opiate addiction, unfortunately, we tend to lose more people to because of the potency of the drugs.
Right. And so let's get now to our sort of last 7 months of interesting living. In March, when everything kind of shut down, what was like the initial impact on, treatments and, groups and everything?
So it was shell shocking. Nobody really knew what the best practice was to do, but they kind of put their medical hat on, and it was, well, the only way we can control it is to kind of stop what we're doing in our tracks and not let people in. If we don't expose the people that we already have in treatment to outside people and we don't let them in, then it's almost like we're in a bubble. But what went with that was the complete shutdown of all resources. So people that were already in treatment, they were kind of in limbo, but they were safe and held on to longer than typical because the next level of care was not accepting new patients and kind of halted. So you saw this kind of like this curtain that just fell and it was like, boop, everybody stopped. And what happened was people that used to have a schedule and be going to active treatment, whether it was AA meetings or an outpatient program or getting a Vivitrol injection, they were at a loss. Their worlds were kind of just stopped in their tracks and didn't know where to turn to for help.
And what was the impact of that? Just having everything stopped? Did you see a lot of rise in people having, serious issues?
Yes. So, the incidence of relapse, whether it be alcohol or opiate, it didn't really matter. You would have people relapsing over the stress of not having their regular schedule intact. People were losing jobs. Kids were out of school. Everything was kind of flipped upside down. But there was a huge impact of relapses of people, even that had been sober for 5, 10, 15 years. It had that large of an impact. And so there was a huge rise in overdoses and then just people needing treatment in general. And the treatment systems had kind of been put on pause. So you have a higher number of people needing it, and the doors were kind of shut for quite some time.
Yeah, so you were talking about, it's sort of important for people to have a schedule when they're in recovery, and if that disruption kind of just, sort of sent them adrift.
Right, and I would say it's like somebody that goes to the gym every day. They used to getting up at 5 a.m., going to the gym, going to work, doing their work day, coming home, and you take that gym out of their schedule every day. It's like they don't even know how to start their day, but they can go out maybe and walk and replace a closed gym with a walk. But how do you replace an AA meeting or a meeting with your therapist for something that keeps you sober, that ultimately keeps you alive? So there's a different impact on people's lives when those types of resources are halted.
And we were talking beforehand, and you had mentioned you'd seen a rise in alcohol use. Just talk about, how being stuck at home and, maybe not having a job or having a job that you're just, doing online and, not having to drive to has sort of led people to, increase their alcohol consumption.
Yeah, so we've seen, opiate abuse, of course, has risen, but not to the degree that we've seen with alcohol. And so you're having people that have been sober for, like I said, 10 plus years that are relapsing. That's a significant time to be in recovery. But when you're not getting up and doing your regular routine and going to work, and it's from, oh, I get up out of bed, I don't have to get dressed for work, so I can kind of stay in my pajamas, and I pick up my laptop and I go to the couch, that can be very depressing. It's very monotonous. You know, going out in the public obviously wasn't advisable at that time with the, you know, coronavirus being so contagious. So you don't want to leave your house. It's hard to do an activity to get into a schedule because of the risk you're putting yourself in. And so you set these boundaries with yourself. Well, my boss isn't around because I'm now in my comfort of my own home, and okay, maybe I'll just have a drink with dinner. Okay, so you've crossed that line, and then, well, I think 4 o'clock's acceptable. I won't drink before 4. Oh, next thing you know, it's noontime and you're having a drink. And so you make these boundaries with yourself, and then you continue to cross them, and then the next thing you know, you're drinking at breakfast and around the clock, and you have set yourself back years and years and years because you had been in recovery. And so depression is on the rise, anxiety is on the rise, because people are losing their jobs and they're losing their regular schedule that keeps them happy and healthy and ultimately, in this realm, alive.
Yeah, well, you mentioned, you know, people who had been in recovery for a long time for alcohol. Are you also seeing a rise in, like, people who maybe would drink but wouldn't drink a lot, just drinking more because they're stuck at home and bored? Like,
yeah.
People who aren't, like, necessarily, you know, in AA, but would just have a drink at night, maybe they also fall into that same pattern?
Yeah, I would absolutely say so. So like a social drinker that may go out on the weekends or a Friday night with their friends, you're seeing even that type of social drinking increase. And so they're drinking at home, which, you know, is maybe out of character for them. Maybe they're used to going out and drinking, but now they're drinking in their home, and they're drinking way more than they usually would, even as a social drinker. It's getting to the point where that even the lack of schedule for a normal person, being stuck in a house, not being able to go to work, things like grocery shopping are now a big task. You have to, you know, you're waiting outside. How many people are in there? It's not very easy. And so the unemployment rate is up. You know, people are at home. And so you're even seeing a social drinker kind of up their consumption. And that goes with the depression and anxiety of being in limbo right now. Nobody quite knows what's going on with a lot of things, and that causes stress.
Yeah. Now talk about the difference of people trying to go cold turkey with opioids versus alcohol, because I know it's more dangerous, right, with alcohol, just
Yes.
to try to, like, you know, if somebody is dealing with this and they're like, well, I should really stop, but it might be dangerous just to quit entirely. Talk about that.
Absolutely. So with withdrawal symptoms, if you're on any type of opiate, they're gonna feel awful, okay? They're gonna feel like they have the flu times 1,000. And a lot of people that think they've had the flu before really haven't had the flu. But you feel absolutely terrible. However, you're not gonna die from those symptoms. You may feel like you're going to die while you're going through it, but
Right.
You just feel really crummy. There's not as much of a safety issue as with alcohol and benzodiazepines, such as you know, Xanax, Valium, Ativan, that type of drug that's a lot of times used for anxiety. You can actually die from withdrawals from alcohol or benzodiazepine. So you have people coming in that think they can stop cold turkey, and they're at a very high risk for seizures. What goes with that is just injury to the brain, but also if you seize and you're home by yourself and you fall and you hit your head and nobody finds you,
Right.
you can't call for assistance. You knocked yourself out. You could be bleeding on the floor. So it's never, ever advisable to try and detox yourself at home, really, from anything, but especially alcohol and benzodiazepines, because those are the two substances that you can actually die from the effects of the withdrawal. So it's a huge safety issue.
I think that probably answers the question when, you know, everything shut down and the only essential services were still open. Liquor stores were one of those. I'm guessing
Correct.
that was probably why. So people
Yeah.
were filling up hospital beds during a pandemic with withdrawal symptoms.
Yeah, you would see people that maybe weren't as educated in the field and be like, how is a liquor store essential, right? Well, yeah, of course, I have to go to Market Basket so I can feed my family and have essentials. But how does a liquor store fall into something that's an essential, company that needs to be open? But I really truly feel that that's part of that rationale, is that the only way for an alcoholic to not go through withdrawal is to have alcohol in their system. So if we cut off that supply, you are going to see people that are at home that, listen, maybe this is their first time trying to stop and they have no idea that it's not safe.
Right.
So that is one of the reasons why those stores were never considered one to be shut down. Because we also don't have the manpower in the healthcare system to help all those people if we did take away that access to alcohol. There's just not enough beds. So now imagine you shut that down and people are asking for help. There's not beds for them. So it's a huge safety issue, and I do believe that is one reason why they chose not to shut down liquor stores.
Right. Now, initially everything's shut down, but then, what was sort of the process of, early on trying to get help to people, and sort of how has that evolved, over time?
So, when everything came out, I think the idea was, if we stop in our tracks and don't let anybody in the door, we'll keep ourselves safe. And that type of mentality existed for quite some time, several weeks to the first, couple months. And then treatment centers saw, okay, well, we know that wearing masks is effective. Why don't we, decrease the number of people we let in so that we can social distance and spread out a little bit more, be able to clean. So you slowly saw things start to open up when we figured out what best practices were and what the safest policies were. But that took some time. So as that happened, things like having groups via Zoom, that was an idea that came about, whether it's therapy, personal therapy sessions, AA meetings, even outpatient services. So somebody that, for instance, goes to an IOP program, they otherwise live at home, but they're going a few hours a day to a treatment center, that would be via Zoom. So they decided that, well, we can help people if we implement these practices, whether it's FaceTime through the phone. Some people might be doing therapy sessions FaceTime with their patients. And there were some people that just still remain close. But that's what you're seeing now. So now you're starting to see things open up, and they're just keeping the numbers controlled. People are wearing masks, implementing all those best practices. But you are still seeing things like Zoom or FaceTime be implemented. For me, I work in healthcare, so I never stopped. And being at the police department, I never stopped. So I had to be very careful when I was out in the peak of this to keep myself safe and my family, as well as, the people I was dealing with, the clients. So a lot of my time was done on the phone. If somebody really needed to have that relatability and that face-to-face, and I did it as safe as possible. Mm-hmm. In an open area, if the weather was nice, outside was a great option. You could sit on a park bench across from each other, social distance, wear masks. You kind of had to get a little creative.
It seems like a lot of innovation was part of it.
Yes, and so it may not still be the most ideal, but even having that face-to-face, 2 park benches away from each other, I find people get more out of it than Zoom through a screen. There's something about that person-to-person connection. So you're starting to see things like AA meetings being held outside, say, for instance, at the high school, at the track where there's huge bleachers and you can accommodate a good amount of people but spread them out safely. But now we're getting into the colder months. And so what goes with that is everybody is now concerned, of course, with flu season and cold season and symptoms mimicking the coronavirus. But now in the healthcare world, in the recovery world, those things like outdoor meetings and sitting outside in 30-degree weather when it's snowing are no longer going to be an option. So we're getting to that point where we're having to get creative and innovative again so we can plan for the winter, and that is seemingly a little difficult. So at least we know that it's sort of coming and we're all working on it, but again, how are you screening patients to be safe, and then how are you actually meeting with them to keep them safe from the alcohol as well as the coronavirus, or the opiates and the coronavirus?
Right. Do you think there were lessons learned when everything shut down immediately that you could take into the winter months, or take in that, if spikes happen and everything sort of goes back to the way it was, though it would be a little bit of a smoother transition?
Oh, absolutely. So I also work in treatment, and for us, we had a period where we, closed the center and had all of the clients that lived in the sober house stay just at the sober house, and the outpatient clients were all teaming in via Zoom. So everybody would be on Zoom together, but we weren't taking admissions, and we were keeping everybody very much contained. But what happened is you're figuring out, the internet connection can't deal with everybody trying to get on Zoom. How do we do that? How do you get people that maybe don't have access to a phone or computer an ability to get on Zoom? Not everybody has that accessibility. Do we have enough masks? Do we have enough hand sanitizer? We have so many group rooms. Can we move chairs and tables around to add an extra group room so that we can decrease the number of people in each room, so that if we do open the center, we've added more space so that we can spread people out. So by the mistakes or the obstacles we saw, because it was like you needed to figure out a scenario that worked immediately when everything first happened. Everybody was like, go, 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 what do we do? I think a lot of people have learned mistakes or learned how to kind of get around that and have a best practice. But I still think that implementing it's going to be difficult, because I think the winter is just going to give us challenges that we're not quite ready for. And you try and plan the best you can, but you can't think of everything.
Right. I mean, if it was going to hit, I guess it hit at the right time.
Right. Right. Like being outside is great, but now it's like, okay, we figured that, we got over that hurdle in the spring. Oh, we can go outside. We can use a football field at a high school in the PA system and have an AA meeting. But now when that's not an option, what are you doing with all these, people in recovery that need the support? And so some of those scenarios, there's just not an easy answer. And so we're trying to kind of figure that out and brainstorm between communities of people and have a big brainstorming, session, is who has the bright idea that's maybe going to work.
Right. I wanted to end with just, people are watching this and, they themselves feel the need for assistance, or they, have a family member who does, how they can sort of, what's the next step for them?
So I would say, if you're not comfortable coming to the police department in person, I completely understand that, and that's absolutely fine, as well as a safety issue. We all practice social distancing and wear our masks, but I still get that home is the safest place for people. I would say call me. My information is on the police department website as well as the town website. You can always call me, email me anytime. Whether you're a family member or you're the person personally struggling. So, sometimes the person struggling isn't ready yet, but maybe mom and dad need some help and support. Whoever it may be, contact me, contact a different department in town if you have somebody there that that are comfortable with. I'm more than happy to do work over the phone, via text, via Zoom, in person, with a scenario that everybody's safe and comfortable. But I would say if somebody's struggling, it's very important to get them help. And that first initial call can be very difficult and it's very fearful, but especially right now with where the world's at, people are struggling and you need to get them access to treatment and support. It's very important. And so it may look a little different right now than traditionally because of what's going on, but the help is still there. And unfortunately, we're losing a lot of people to addiction, whether it's alcohol or opiates. The rise is up. People are very depressed and anxious because of life stressors due to the coronavirus that are out of their control, and they feel like their only option is to just pick up a substance. And unfortunately, we're losing people.
Yeah, it's a very sad situation, but it's good to know that people like you are out there trying to help people. All right, and I also want to thank you for taking some time today, for coming in and sharing all your thoughts and expertise with us.
Thank you for having me.
So there you have it, a look at the PARI program and how it has responded during the pandemic. I'd like to thank my guest, Captain Greg Skehan, and Program Coordinator Margie Taylor. I'd also like to thank all of you for watching. We'll be back next month with another edition of BNEWS In Depth, so stay tuned.